Yep.
Okay.
So here we go with the respiratory system. We're going to start with conducting zone. It begins with the external nares, which are basically just your nostrils. That leads into your nasal cavity. Your nasal cavity has nasal concha. You've got a superior nasal concha, middle nasal concha, inferior nasal concha. And this little guy right here, that's your auditory tube. From there, it's going to go into your pharynx. And your pharynx has got your nasopharynx, which is this part up here, oropharynx, and laryngopharynx, just like Courtney said in the previous video. We've got the hard palate, which is this part right here with the bone, and the soft palate, most posterior without the bone. And you've also got the uvula, and that's a dangly little thing in the back of your throat, if you've ever wondered what that was. Now we're going to go to the larynx. The larynx has got the thyroid cartilage on the sides here. It's got the laryngeal prominence here, which is the most anterior aspect of that. It's kind of like what you'd see with your Adam's apple. It's going to split off down here with your cricoid cartilage. It's going to go all the way around too, so keep that in mind. It goes up to this part as well. You've got your epiglottis, which is this guy right here. And if we look inside, we've got ourselves the vocal cords, which is kind of on the inside of this pink right here. And you got your vestibular folds, which are going to be more lateral on these guys right here. It's going to, at the very bottom, it's going to go into your trachea. But we're going to continue the trachea with this model. The trachea goes down here, and it hits your carina right here, where it's going to split off into your primary bronchi, which are these guys right here. And then it's going to go into your secondary bronchi, which are these, into your tertiary bronchi, which if you can see it's kind of hard, but it's right here, the third branch. And from there it's going to go into your bronchioles, which are the colored parts, and the terminal bronchioles are at the very end. So once again, trachea, carina, primary bronchi, secondary bronchi, tertiary bronchi, bronchioles, and terminal bronchioles. Now, if we look back at this model, we're going to have the alveolar ducts, alveolar sacs, alveoli, and respiratory bronchioles. This is the respiratory bronchioles. It's going to split off into the ducts, your alveolar ducts, which is going to go into a collection of alveoli, referred to as an alveoli sac. And the individual bubbles, which you see here, are the alveoli. And if we look at this guy, we've got the base of the lung, the apex of the lung. We've got the pulmonary hillis, which can be seen over on this side. The pulmonary hillis is where the vessels are going to come out of, which could be represented right here or right in here. This is going to be the right lung. This is going to be the left lung. The right lung has 3 lobes. The most superior lobe is going to be called the upper, then the middle, and then the lower. And they're split by the horizontal fissure here and the oblique fissure here. On the left lung, you only have 2 lobes, upper and lower, and they're divided by this, the oblique fissure. The left lung also has a cardiac notch, which can be seen right in here, and that's where your heart is going to sit. And that'll do for the lungs.